Growing up, I was never taught about my body. For a large part of my childhood, I was raised by a single dad. And as I'm sure you can guess, the last thing a dad wants to talk to his daughters about is anatomy, sex, and orgasms. I also grew up in a very religious household. I went to church every week and went to a Christian private school. There was no sex ed, no health education, and although I had access to Google, what even was I going to search? Imagine if I asked you to pull out your phone and Google sex education or female anatomy. I think you know what type of videos are going to pop up. Some of you may be wondering, why didn't I ask my doctor? So I want to take you back to my first pap smear. I needed birth control, as many sexually active teenagers do, and I went to the gynecologist's office at 17. They take you back to a patient room and they tell you to undress. It's cold and they give you a thin sheet to give you a sense of protecting your modesty, when in reality, your doctor is about to get a front row seat to all of your business, whether you have a sheet or not. The doctor introduces herself and says it's time for your pap smear. You smile and nod, so inconspicuously, so she'll never know it sounds like she's speaking another language. Then out of nowhere, she pulls out a metal penguin-looking beak, calls it a speculum, tells you to lie back, push your butt to the edge with your legs wide open as she uses the metal beak to open your vagina so she can swab your cervix. At the time, I had no idea what my cervix was, so how on earth was I supposed to ask clarifying questions when I hadn't even been taught the words to ask the questions? Even if I did ask questions, my doctor might not have been able to answer them, because things like the anatomy of the clitoris is left out of medical textbooks. Years go by, and my doctor's visits stay consistent. I had no idea what was going on, but I got the hang of things. So there I was, a sexually active 20-year-old, and I got pregnant. Paralyzed on the edge of my bathtub, staring at a positive pregnancy test, I felt a flood of uncertainty, fear, and doubt. Fear of the future and doubt of myself. I felt the weight of potential for both of our lives was resting heavily on my shoulders. Now, I won't get into the specifics of my decision, but I will say that no one is more qualified to make that decision than a woman who is taking stock of her life on the edge of a bathtub. So there I was, a pregnant 20-year-old with no sex education, no clear idea of what pregnancy even was, and a lot of decisions to make with very little information. Luckily, I had no idea I was about to get the education of a lifetime. For those of you who know me, you know what I'm about to talk about. The grandma to my baby girl is none other than the Vaginacologist. The Vaginacologist is the online persona for Dr. Teresa Irwin, a female pelvic medicine and reconstructive surgeon in San Marcos, Texas. This is a woman who has dedicated her life to surgically repairing pelvic dysfunctions that often result from pregnancy and childbirth. I mean, can we talk about luck? Within the first couple times that I met Dr. Irwin, we had already talked about sex, incontinence, Kegels, hypopressives, and female anatomy. I went from having absolutely no sex education to talking about pee, poop, and vaginas at the dinner table. At the beginning of last year, we started talking about her goals. She talked about how much she loves her job, but that so much of what she does could be prevented or helped with education. Now you may be thinking, isn't this how you get paid? If there was readily available women's health education, wouldn't she be out of a job? And the truth is, she wouldn't mind being out of a job. Not that she doesn't like her job, but because if she did not need to perform her surgeries, that would mean that less women are suffering and more women are educated on how to take care of their bodies. Most women are taught that incontinence, leaking, and prolapse is just a normal part of getting older and having babies. The fact that no one wants to talk about is that 50% of women will struggle with incontinence at some point in their lives. 50%. 50% of women will uncontrollably leak urine or poop. 50% of women will miss out on time with their families. They may feel embarrassed and not want to leave the house. They may need to go to a nursing home because their incontinence issues are too much for their family to handle. 50% of women will struggle because of a lack of education. This is when we got a kooky idea. Why can't we provide that education? And the short answer is, we are. In 6 months, we created her online persona, the Vaginacologist, and we grew her social media following from 0 to over 75,000 followers across platforms. The goal was simple: to empower women with the education they need to reduce their risk for pelvic dysfunctions. What we found out is there is a huge demand for women's health education. We were flooded with questions from women all around the world who had been suffering in silence and just needed a place to learn about their bodies. This lack of education is the product of many years that the scientific community believed that men and women were essentially the same, and the only ways that they were different were predominantly in their nether regions. So a lot of the research that developed our pharmaceutical drugs and the information that goes into medical textbooks was done primarily on men. This poses a unique healthcare disadvantage to women because men and women are not the same. They can process drugs differently, they have different hormone levels, and they may not even have the same symptoms for common diseases. One study found that women are more likely to die of a heart attack because they often don't present the same symptoms that men do during the onset of a heart attack. Since the research was based on male symptoms, it takes doctors longer to realize that a woman is having a heart attack, and it takes longer for her to get the life-saving treatment that she needs. We desperately need reform in health education that acknowledges the unique differences between men and women. But until there is systematic reform, we can empower ourselves with the education to be our own health advocate. Education gives us the tools and the vocabulary to vocalize our questions in a way that will make us understood. Imagine if I went to the doctor and I said, I was uncomfortable down there. Do you think she would be able to know what I was talking about? Maybe after 10 follow-up questions, but how about if I went to the doctor and I said, I am having bladder discomfort when I pee. Can you please run a urine analysis and a culture to see if there's bacteria present? Not only will she understand what I am saying, but I will also have demonstrated that I have the knowledge to do a preliminary diagnostic on myself. So I evaluated where the pain is coming from, when I feel the pain, and what my combined symptoms could mean. Now, I don't want everyone to go out and start using WebMD against their doctor. I don't think that's going to help anybody. But I'm talking about health education that allows you to take an active and informed role in your health and to understand what is going on with your body. Being able to articulate the health problems you are experiencing increases the likelihood that you will get the care you need and get it sooner. When you are educated, when you know what is going on with your body, you can take an active and informed role in your health and work with your doctor towards treatment. And let's say the doctor refuses to run a test for whatever reason, or if they offer to run a different test. When you are educated, when you know what is going on with your body, and when you feel empowered to use that knowledge to your benefit, that refusal can trigger alarm bells. So you can say, can I get a second opinion? Or can I get that refusal in writing? This empowerment completely shifts the doctor-patient relationship. Many of you may remember when Serena Williams gave birth to her daughter in 2018. She almost died due to a pulmonary embolism, which is a condition in which one or more arteries in the lungs becomes blocked by a blood clot. She had a medical history of this condition, and so she recognized the onset of the symptoms. She went to tell the first nurse that she could find what was going on and requested a CT scan with an IV of heparin. Serena knew exactly what was going on with her body and the types of tests and treatments she needed to save her life. But instead of immediately getting her those tests, the nurse thought that the pain medication might be making her confused. And so instead, they ran an ultrasound on her legs. Serena continued to be her own advocate and insisted on what was going on. And eventually, they got her a CT scan, and she was right. Several small blood clots had settled in her lungs, and minutes later, she was on the IV drip. Serena saved her own life by being educated on her health and by being empowered to be her own health advocate. And this story is even more powerful when you put it in the context that right now, the US has the highest maternal mortality rate of all developed countries. And even though many of these deaths are preventable, the rates are actually increasing in the United States. This also disproportionately affects minorities because Black women are 3 to 4 times more likely to die due to pregnancy-related complications. We can no longer deny that there is bias in our medical system that costs women their lives, especially women of color. This is why education is essential for actively combating the inequality that has passively flourished in our medical system, and why education is essential for empowering women to be their own health advocates. We have the knowledge, we have the technology, and now we just need to put forth the effort to make sure that the systems that we have put in place, the systems that govern us, the systems that heal us, and the systems that educate us are adapting and evolving with us as we become more fair, more aware, and more equal. Doctors have spent years in education and training to get their expertise, and doctors are still human. They are limited by time, resources, and the patient's understanding of their language. And I'm not talking about English or Spanish. I'm talking about the medical jargon like the penguin-looking beak that doctors call a speculum. Doctors spend almost a decade learning a whole language of technical names and hyper-specific terms that allows them to communicate more effectively with other doctors, and it can unintentionally make it more difficult for them to communicate to us, their patient. When you learn the language of medicine, you will be empowered to communicate your needs in a way that will make you understood. It is also essential that we have experts who are willing to try to explain what they know to us. And as patients and as the public, we need to creatively bridge the gap between their expertise and our understanding by translating their knowledge into terms we can learn and understand. So if you have expertise to share, start brainstorming creative ways to explain commonly asked questions, misconceptions, or even what you wish you knew when you were first getting started. Show your support for equality in women's healthcare by signing online petitions to get clitoral anatomy in every medical textbook. Now, I know not everyone can have the Vaginacologist on speed dial, but there are so many experts who are already sharing their expertise online and want to answer your questions. The critical step is learning how to ask the questions. So if you're ready to learn, start evaluating where your lack of knowledge comes from. It could be school, religion, or even a generational lack of knowledge, because your parents can't teach you what they never learned. But once you learn it, then you are able to pass that knowledge onto your children in your community to initiate a generational change. Once you know where the gaps in your knowledge lie, start looking for digestible ways for you to learn. Follow a doctor on social media or introduce an educational podcast into your daily routine. This will allow you to take an active role in your health by passively learning on platforms you already use every day. When I first went to the doctor, I was so shy. I wasn't able to ask questions, and it wasn't the doctor's fault because I was embarrassed about my own lack of knowledge and understanding. I felt like maybe I wasn't supposed to know what was going on with my body. My body was just supposed to magically take care of everything, and I was just a passenger along for the ride. And the longer I went without the knowledge, the more I felt like I didn't need it. If I'd survived almost 2 decades without knowing the difference between my vagina and my labia, how much of a difference could it actually make? And the truth is, it might not make a difference right away. But as time goes on, you might start having discomfort. You might have children. You might have an irregular growth, and you might not catch it before you end up in Dr. Irwin's hospital room. The burden of healthcare reform is shared by doctors and patients. Health education and reform may be a couple of years away, but educating yourself is something you can do today to drastically transform your healthcare experience. As someone who has been uneducated about women's health and now knowing what I know in just a short time, I cannot believe how much different it feels. It's one of those things I can't explain to you. You just have to experience it. And I hope that one day all women will experience it just as I have. And hopefully it won't take 2 decades and an unplanned pregnancy to get there. Thank you.